Hi everyone, I am Dr. Daria here with Dr. Michael Breus for
Hey.
installment series number three of our series of what would you do for more sleep and how to get it. We are talking about special tips, some of our favorites from the newly released Mom Hacks.
It's awesome. I know you've already got the book. Drill through it. You're going to learn a ton.
Yes, and remember the whole point, you don't have to read it start to beginning to end.
No.
Go to the table of contents, find what's troubling you the most.
Exactly.
Start there, you're going to feel better. So, our first 2 segments we talked about the scope of the problem, how to get your kiddos to sleep, and the second segment talked about prevention and removing some of those sleep obstacles.
Right.
This one we're talking about, you've done all those things
Right.
and you're still staring at the ceiling,
Right.
which is such a helpless, awful
Absolutely.
feeling. So there's different classes of that. So first I want to talk about when you have trouble falling asleep, which is very different from when you wake up. So
Absolutely.
trouble falling asleep.
So
Let's talk about what to do.
this is what I've labeled it mommy-somnia. All right. So, and there's lots of different flavors of mommy-somnia, right? And so we're going to talk about the first flavor, which is I can't fall asleep. So 99% of the time, this is usually some form of anxiety, right? And so it's really, I tell people all the time, sleep is a lot like love. The less you look for it, the more it shows up, right? And that's really how it works.
Which is going to be the next slogan on Match.com. Stay tuned.
Right. So when you're thinking about going to sleep, here's the deal, is it's really about distraction or understanding sort of what's been going on in your day. Because remember, when you lie down in bed at night, you turn off the lights, it's literally the first time you've had a chance to think about anything.
The first quiet moment.
And it all comes flooding in, and you're thinking, oh crap, I forgot to do this, I forgot to do this. And so what a lot of moms tell me that they do is they try to create a list in their mind, and then they go over the list over and over because they
ruminate.
think, right, they want to burn it into their brain.
And why did this person say this to me? And I should have said this, and how dare they?
Right.
Because you catastrophize your brains.
Right. Well, and remember, you're sleep deprived.
Yes.
So a lot of what you think is probably not as accurate as you think it might be. So step number one, what I have all of my moms do is what I call a worry journal. So you take a piece of paper, you draw a line down the middle, and you just write down all the things that are bothering you. Now this should be done about 2 hours before bed, right? So give the baby to somebody to watch and play and be cute, whatever it is, and then just take out this piece of paper. And by the way, this doesn't have to be a book, right? You write down, sleep deprived, and then right next to it you write, read that chapter in Mom Hacks.
An actionable thing what to do.
So one actionable, it doesn't have to solve the issue, but just one actionable item.
Yes.
It lowers that level of stress.
Right, because you're addressing it.
Right. That should be done 2 to 3 hours before you're in bed, right? Now, let's say you've done that, you lie in bed, you're not worried about any of those things, but you're still not having an easy time falling asleep. What are some different things that could be going on? Most people don't know this, but in order to enter into a state of unconsciousness, you need a heart rate of 60 or below.
Be relaxed.
Got to be chill, right? So how do we chill? Well, one of the easiest ways to do that is using the 4-7-8 breathing method.
Ooh, okay.
So this is super interesting. This was actually developed, believe it or not, by Navy SEALs.
Okay.
So this is going to sound bizarre, but they used it for their snipers. So they
Yes, exactly.
right, because
they have to regulate their breathing.
Exactly, because if you don't regulate your breathing, you could throw off the trajectory of the bullet. So they have to have super low heart rate. So you breathe in for a count of 4, you hold it for a count of 7, and you breathe out for a count of 8. If you do 5 to 7 cycles of that, your heart rate drops almost
Naturally.
immediately, and now you're in the zone of even being able to fall asleep.
Yeah.
And so that's one technique that I use with all of my moms. And plus, by the way, it's a good stress reliever, so it's not a bad thing to do even during the daytime. If you find yourself really, too anxious, give yourself 5 minutes, walk into another space, go into a restroom. 4, 7,
I do a
8
similar
breathing.
thing. I just do 4, 4, and 4, but it's something again we do in the ER. And I like it. You go to the snipers or the ER to say, how do these people handle these high stress situations? How do we distill that down?
Exactly.
And I think the other thing is look at what you're doing beforehand. If you are running around the
yes.
house
We're
and
gonna get
laundry
there.
and lights are on, okay, well then I don't want to get out of order.
Okay,
So,
it's all good. It's all good.
okay,
So now we're going
do
to
it.
talk about the power down hour.
Yes,
Right.
exactly. Which is,
So-
I love this for mama and all parents.
Absolutely.
And for baby.
Absolutely.
And we do it for our kiddos, but we tend to forget about it for ourselves.
Yeah, totally. So here's the thing. Sleep is not an on-off switch. It's more like slowly pulling your foot off the gas and slowly putting your foot on the brake. There's a process that has to occur there. We've got to give our bodies that time for process. Now, I know a lot of moms don't have an hour before bed, okay? But let's shrink it down to a half an hour, right? So 30 minutes, let's say your bedtime for you is 11 o'clock. Starting at 10:30, for 10 minutes, just get stuff done that has to get done before the next day.
Yeah.
So in our house, it's getting backpacks together, finding sports equipment. If you have older kids, making sure that their needs are being met. After 10 minutes, stop.
Done.
Then move over to hygiene. Brush your teeth, wash your face. If you want, take a warm or hot shower. There's data to show that if you raise your core body temperature before bed and then get into bed, it helps you fall asleep. So that could be a good time for that. And then 10 minutes for some form of meditation, relaxation, prayer, whatever works for you to just chill, right? So you could do the 4-7-8 breathing there. You could do something called progressive muscle relaxation.
I love that. That's
one
in
of
the
my
book.
favorites. I
Know
know.
the hacks, and it's something I learned from an ER psychiatrist.
Yeah.
So they know stress.
Yeah, for sure. And I mean, that's something that I use with almost all of my patients, and it really helps because you tense and relax muscles from the top of your head to the tip of your toes. First of all, it's just an enjoyable practice.
Right.
And it really puts you kind of into the moment and gets you chilled out. And the breathing with the progressive muscle relaxation, most people fall asleep right away there. If you don't, one other really kind of interesting hint that I have people do is a gratitude list.
Yes. Oh, I tell people to do this.
So,
I love this.
Believe it or not, there's data to show that if you have positive thoughts before falling asleep, not only do you fall asleep quicker and get into deeper sleep faster, you have more positive dreams.
Oh, I didn't know that.
I know, it's super cool.
I like the gratitude list because there's also data that shows if you just spend 30 seconds doing it, you can actually make yourself more of an optimist, which are things that we never knew we could set. We thought that was genetics and your childhood upbringing.
Yeah.
But so now I know even more reasons. And I think that worry locker you talk about, that worry journal, if other thoughts pop up, pull it back out,
Absolutely.
write it down, lock it away. Like, it's done. I don't need to think about it because it's there, it's safe. I can pull it up tomorrow. And then 90% of the time, in the bright light of day, I talked about this on Dr. Oz. You look and you're like, why did that even worry me?
Right, exactly.
Why was he thinking? So just lock it away, let it go.
Absolutely. Middle of the night, wake up.
Yes, exactly. You
I know, I knew where you were going.
I want to switch to that. So then a lot of moms say, I have no trouble falling asleep.
Because I'm so exhausted.
Exactly. But then I wake up in the middle of the night. Or baby cried.
Right.
I used to do this. The babies would start to cry. I would leap out of bed, unconscious, superwoman style.
Yep.
And then I'd land halfway through my room. The baby's back asleep. And like,
and your heart,
I'm awake for the night.
Right.
So what do you do?
Right. So some of the techniques for before the beginning of the night can actually be used in the middle of the night. You can definitely use your 4-7-8 breathing. You can definitely use your progressive muscle relaxation. One of the things I talk about with moms is what happens when you woke up for no reason? Like there's no baby stirring, there's no partner moving around, there's no animal in the bed, but you just woke up.
Yeah.
So one of the things we discovered, which this is going to sound like the easiest hack in the universe, but it really works well.
Which is good. I like easy hacks. People think they don't work.
No.
But they do.
They do. So what I usually do is I ask people what's the timing of their last meal. And they say, well, I kind of grabbed something around 7, 8 o'clock. It's now 3 o'clock in the morning, which is roughly 7 hours later. Your body's out of fuel.
Totally.
Yes. So a lot of people think that when you put the body into sleep, it's like putting the car in park. Nothing could be further from the truth. Did you know that during REM sleep, you use as much glucose in your brain as you do when you're wide awake?
Yeah, well, it's busy.
Right. There's a lot of stuff going on there. So this is a super easy one. A teaspoon of raw honey 30 minutes before bed. Not if you're diabetic, right? Not if you're diabetic, but a lot of people...
And this is for adults. This is not for
adults.
young children
not for kids. But it's great because what happens is raw honey is very difficult to metabolize, and so it keeps your blood sugar up longer.
What if you're doing time restricted eating?
So if you're doing intermittent fasting, so that's a great question. So when you're looking at intermittent fasting...
This is another thing I'm a big fan of, is how I lost the baby weight when I was still nursing.
Is, first of all, you need to know what your chronotype is. Are you an early bird or a night owl?
Which is your book.
Which is my book.
Yes.
Because that'll tell you the timing of when you should be doing intermittent fasting. A teaspoon of honey is not going to blow your intermittent fast, number one. But number two, I'm asking people to have their meal times later, specifically closer to bedtime. So that way they end up not waking up in the middle of the night being hungry.
Not a huge meal within what, like 2 hours before bed, something like that?
Correct.
So otherwise that impacts your metabolism and it impacts your sleep.
Completely. And that's why we like the honey, because it's easier.
Yeah, and I think also just really need to mention is alcohol. You have to be careful. People use alcohol to help them fall asleep, but then several hours...
Number one sleep aid in the world is alcohol.
Several hours later, it causes you to wake up in lower quality of sleep. So something to really pay attention to if you're struggling with sleep.
There's a really big difference between going to sleep and passing out. Right? And so 3 glasses of wine doesn't make sense. Right? Like, I get it, you're stressed, and that is a form of coping skill that can go in the wrong direction very quickly for a lot of people. Limit it to 1, maybe 2 glasses of wine. Do 1 glass of water for every glass of alcoholic beverage, because remember, it's a diuretic, so you're getting dehydrated. and you're already really dehydrated.
Especially if you're nursing.
Right? So think through that idea. And then the final one is giving yourself 1 hour per beverage. So if you have 2 glasses of wine and you stop at 8, you're going to bed at 10, you're fine.
Yeah. And I usually tell for women, 1 glass of wine, really on average a day is what you want to aim for.
Absolutely.
So here or there a little bit more, but otherwise that. All right. Any other tips? Because we are out of time. I think one last tip is when you wake up, don't look at your alarm clock and don't pick up your phone. Just don't do it.
Completely, yes. So the most stressful thing in the universe is you pick up your phone and then you instantly do the mental math and you say, oh my gosh, it's 4 o'clock. I've got to be up at 6. I've only got 2 hours left. Sleep. It never works.
Nope.
You're all jacked up. The last thing you need to do, don't look at the clock for sure. And by the way, if you don't have to pee, don't.
Yeah, just don't get out of bed.
Yeah, if you don't have, like, I'm not saying if you got to pee, right? I get that. But if you don't have to, because you go from a seated position or lying position to a seated position to a standing position, your heart rate's over 60.
Right.
Remember, heart rate below 60 to get back to sleep. Better that you lie there, chill, do your meditation, do your relaxation, run through a gratitude list again, whatever you can do to chill, and you'll fall right back to sleep.
And if there's something that wakes you up, like you're thirsty in the middle of the night, well, then keep some water by the
Exactly.
bed, keep some tissues, try to head that off at the pass.
Absolutely.
Michael, thank you so much. Everyone,
Sure.
again, I'm Dr. Daria. This is Dr. Michael Breus. You can read much more about him in my book, Mom Hacks. It is out. Enjoy. All of you watching hopefully have this, so you'll find some great tips in there. Let us know what you want to know more of. We can do more of these, so make sure you put in the comment section, message us online on Instagram, Facebook, Twitter, all of those places. Thank you so much, mamas, and have a good day and get a good night's sleep.
Sweet dreams.